Namaste and hello. Welcome to Welcon. Welcon believes in health transformation and beyond. Today on our talk show, we have a renowned doctor with us, Professor Arun Sanyal from the Department of Gastroenterology, Virginia Commonwealth University and Medical Center, Richmond, Virginia, USA. Welcome to this show, Dr. Sanyal.
Thank you for having me.
We are really, really honored to have you with us today.
It is my pleasure.
And I'm sure the audience and the people who are interested in looking at overall health will come across with many, many options of living a healthy life. And with Dr. Sanyal's experience and what I have heard and seen of him, I'm sure we'll benefit a lot. Thank you once again, Dr. Sanyal.
I'll look forward to talking to you.
Great. So starting our show, basically, we have seen that many of us, what we have noticed is that we reach a doctor when we are not well. I truly believe that we should look after ourselves to such an extent that we really don't need to go to the doctor by taking small steps in life. Today we are here at the venue of the National Congress in Basel, and you are here so specializing in liver. As a professor and your experience here, how would you say that liver is, or rather we can say liver is a very important organ of our body, right? And how important is it, or how should we look at liver in our body?
So thank you for that. First of all, I want to agree with you that prevention is always better than trying to tackle a disease when it's blown up in our face. Having said that, the liver plays a very important role in our health. And to be facetious, there's an old saying that is life worth living? It depends upon the liver. But the liver is a central organ that has myriad functions. So one of the most important functions of the liver is it is the first stop that the nutrition that we eat, when it enters the body, it's the first place where it stops, and the liver can process how it then tracks the nutrition and sends it to the rest of the body as fuel. So in that way, the liver is a central organ that determines fuel availability along with our fat stores and muscle to determine the overall, what we call the metabolic state of the body. What is the metabolic state? Metabolic state refers to our ability to convert the nutrition into energy. Without energy, you cannot live. So just to put it in perspective, if you had no metabolism, you'd be dead. So metabolic health and having good metabolism is fundamental to everybody's life. It is not something that only affects a few people. From the moment of conception to the moment of death, metabolism is a central part of what makes us living things. And the liver plays this central role as a metabolic organ. When the liver goes down, the heart starts malfunctioning, the lungs start malfunctioning, the kidneys can shut down, the brain stops malfunctioning. So the liver disease, when the liver becomes unhealthy, has a ripple effect that affects many other organs in the body. And the liver does not do this in isolation. It is constantly talking to all these organs so that there is coordination of activity across these organs to maintain our health.
Wow. I myself didn't know that it goes so deep inside. And so it would be that if the liver gets affected or has disease in it, it would primarily mean that it affects nearly all the functioning of the body.
Absolutely.
Oh, okay, great. So, sir, I'm taking up some of the questions which the public has put up to us. And so the second one which I would like to know is, what would you say are the early signs of liver problem?
I think one of the things to appreciate is because the liver plays such a vital role in our body, It is also the first place where all the bacteria and the dirty stuff in our intestine, when it gets absorbed into our bloodstream, the liver is the first stop for that as well, and the liver filters it off. So the liver really plays a very central role in our body's health. And because this is so critical for survival, God gave us much more liver tissue than we actually need to survive from day to day. So you only need about 20% of your liver to keep maintaining more or less normal liver function. So the liver continues to work even when it's ill because we only need a small portion of the liver to be functioning. So most liver disease, chronic liver disease, is silent for many, many years. It's just like blood pressure. Unless you check the blood pressure, you won't know that someone has high blood pressure. It's the same thing for the liver. But if you have symptoms of liver disease, the chances are that you have already got very advanced liver disease. And those symptoms could be turning yellow, having pain in the upper part of the abdomen, having a lot of scratching, things like that, experiencing unusual bleeding from the nose, gums, or vomiting blood. But those are all signs of very advanced disease. And generally, we don't want to wait till all of those things happen. So the liver, just like blood pressure, is one of those things where the health has to be assessed in an intentional manner by going and getting your blood work done and to have liver tests run so you know what's going on in the liver in a proactive manner rather than in a passive manner, waiting for the liver to tell you something is wrong. Because the liver will not tell you something is seriously wrong till you've lost a lot of liver function.
Oh, so this is a very important point, I would say, because the liver, if the damage is in the liver or the symptoms of the liver disease shows up only after 7 to 8 years or 10 years, that means half of the liver is already into a state where we can call it that it is diseased today.
Exactly. So depending on if your glass is half full or a glass is half empty kind of person, the other way to think about it is that's 8 years worth of lost opportunity to actually turn the ship around and prevent the problem. Remember, we started with the issue of prevention.
Prevention, yes.
So these are all opportunities to prevent the development of advanced liver disease. The good news is in the early stages, it has not much impact on the body because the liver can continue to maintain core functions. It's only when it gets to advanced disease and cirrhosis that all kind of badness starts happening. So these are all opportunities to identify the problem and to fix the problem before it becomes a problem.
So, what would you suggest? How should a person living a day-to-day life, they're not feeling ill, they're not, feeling down or anything. What should they do?
I think from a just health maintenance point of view, when we have our annual physical examination, we strongly recommend that you get your regular blood counts done, which should include something called a platelet count, and also a hepatic panel, which is just checking your liver enzymes and liver functions.
Okay.
These are simple blood work, doesn't cost much, even in an Indian context. And this can allow us to first see if the liver enzymes are abnormal. Number two, we can compute a test called the FIB4 test.
Okay.
So we developed this FIB4 test based on age, the blood counts, and the liver enzyme numbers. And the score tells us if there is underlying liver damage. And the way the score works is if it is normal, then we can with great confidence say there's nothing bad happening in your liver. We can reassure the individual. If the score is high, that's a trigger point saying, hey, something is going on in the liver. Pay attention and maybe do some additional testing. So that could be a great place for primary care physicians and for patients to go ask their primary care physicians, I want to know my FIB4 score. Remember this, the FIB4. FIB stands for fibrosis or scarring. And as the liver disease gets progressive, the liver starts scarring. So this score, which is based on 4 different things that go into the formula, is the fibrosis 4 score or the FIB 4 score.
Okay.
And this is really worldwide now accepted as the first step in this assessment process. And if your FIB 4 score is more than 1.3, you should ask for a referral to see a gastroenterologist or a liver doctor.
Oh.
If it is less than 1.3, you're in the green zone. You're safe.
Okay. Okay. Great. So it's not very difficult to keep yourself in check. And the easiest way, I have noticed or come across patients who always come at the time, as I started off with that when they already have it there in the disease. All we need to do is get a check done once a year would be good?
Initially, once a year, as part of your routine annual physical examination. They are already checking your hemoglobin, they're checking your kidney numbers, they're checking your cholesterol, blood sugar. Just add a liver panel to it.
And it's not very expensive either.
No, it is not expensive.
It gets expensive when you get into the disease, I guess.
When you get further down the road you get with the disease, the more expensive the care becomes and the more difficult it is to turn the ship around. So early detection and preventive health maintenance is really important, because preventive really involves living. It's common sense. You have to control your body weight. You have to exercise regularly regardless of your body weight, because that you have to keep your muscles active. When your muscles are active, the muscles have a lot of functions which are similar to the liver and can compensate for what the liver does. And so if you have healthy muscles, you will have a healthy liver as well.
Wow.
And so maintaining physical fitness is extremely important. And then again, watching what you put in your mouth. India is the land of yoga. Mindfulness came out of yoga.
Yeah.
Be a little mindful about what you put in your mouth every day. Don't just stuff your mouth because it's available, food is available. And don't get overly impressed by all the commercials and the marketing pressures that you see all around you about eating this or eating that. Use your common sense.
Yeah. I guess which is not too common these days, because I'm sorry to say that, but yes, it pains me when I see people, ignoring such easy and simple tricks to look after themselves.
Yes. Another part of this whole story is mental health. Take time in this world where we're so connected, there is no downtime. Every night, I just speak for myself. When I wake up, there are already 50 messages that came in overnight, and that from around the world, from various people. All night long messages come on to the point that the cell phone keeps lighting up,
Yep.
and then you cannot sleep.
Yeah.
So you have to learn that, take time to turn it all off, recalibrate inside your head, and take time for yourself. Be a little mindful, spend a little time talking to other human beings like a human being. These are not rocket science things. This is just common sense about a healthier way of living.
Absolutely, sir. I absolutely agree with you. And, I commonly also see at restaurants or anywhere you go, you're going out with your family, and you see that if there are 4 members of a family sitting at a dining table to dine, I think they've gone out to spend time together. But
3 of them are looking at their cell phone.
It's crazy, and
Yeah.
I often laugh at myself. I say, what the hell? Sorry for the language, but
Yeah.
yes, if you've gone out to spend time together, downtime, like he's saying, the me time or family time, and we are all at our phones.
I think good mental health is central to being able to lead a more healthy life.
Yeah.
And through that, when you lead a more healthy life, not only is your liver going to do better, you can have your blood pressure is going to be better controlled, your cardiac risks are going to be better controlled, your likelihood of developing diabetes will be improved because you're leading a more healthy style, you're keeping the fat in your body in check, you've got healthy muscles, healthy liver, making sure your metabolism is working correctly, and that keeps all the organs in your body healthy.
Hearing you speak so passionately, actually, I'm feeling like I'm getting a lot of energy and I want to put up my shoes and go for a walk or a jog and take out time for myself because, yes, we get life just once. And I
Exactly.
think we owe ourselves happiness.
Absolutely.
So, ladies and gentlemen, taking it forward from here. So, what causes liver disease? I'm sure a few points we've already discussed here. But is there
I,
anything else that you would
yeah,
like to?
yeah, I would like to point out that there are while there are many, many types of liver disease, only 3 or 4 diseases account for over 90% of all liver disease. And much of it is self induced. So, alcohol is number one,
Oh,
harmful amounts of alcohol consumption,
okay.
which is defined by more than 2 to 3 drinks per day, definitely can contribute to liver disease. From a overall health perspective, there is no amount of alcohol consumption, even 1 drink a day, on a regular basis that is healthy because it has been linked to cancer risk, particularly breast cancer.
Oh,
And so alcohol is a toxic molecule, but it's ingrained in many aspects of our culture. So if you cannot live an alcohol-free life, at least drink in moderation. What is particularly bad is binge drinking, where you have more than 4 to 5 drinks in one sitting. And particularly if you binge drink more than, binge drinking is just bad. So I'll just leave it at that. In addition to alcohol, the next thing is our diet. So the amount of food we consume has to be matched to our exercise and our body's needs. Because the purpose of eating is one, to provide nutrition to our body, and number two, there's obviously a hedonistic, a joyous aspect of eating. So while we get the joyous aspect, control, everything in moderation. So Buddha said, live in the middle path, right?
okay.
Don't go crazy this way, don't go crazy that way. Find your truths in the middle. It's such a great life truth that find that moderation in your life. Nobody says you don't eat this. And, don't turn your eating habits into some crazy thing where you say, oh, I can only have this and I will never touch that. Our body, we like different types. We are hardwired to like different types of tastes and flavors and foods, and embrace that, but watch portion control. And then don't go crazy in any one direction. The word in lifestyle is the word life. The way you live has to be sustained for your life. Making huge changes, which you cannot take more than a few weeks and then you lose, really doesn't help you in the long term. The point of this is to live a longer life, and for that, whatever you do has to be sustainable over the course of your life.
That's how the New Year resolutions never work because I
That
think they
exactly.
take,
They are too extreme and they're
yes,
not sustainable. Making small changes that are sustainable, make those changes as a family. If one person in the family changes in a certain way and the others are still living in another way, which is unhealthy, frequently the individual person perceives that they are being punished because they are being asked to eat a diet which maybe doesn't give them the same pleasure as the unhealthy diet, because for some strange reason, everything that tastes good often is not great for you from a
yeah,
health perspective. So you have
yeah,
to exercise moderation. So
yeah.
when the whole family makes a change, it's much more sustainable. So also then brings the whole family together. And when the whole family is together and happy, you're going to be happier mentally. And if you're mentally happier, then that will translate into better health for you. And then it'll affect your metabolic health as well. So that's how you connect the dots all the way to the liver.
Correct, correct. And I think the homemaker or the lady of the house can make an impact to a great extent where if she encourages a healthier way of living, not keeping processed food at home, the soft drinks, the cold drinks and things like that, because it has huge amount of sugar and so on. So it starts from the home, I think. Yeah.
Absolutely, because simple things you can do is cut out the sugary beverages. anything that contains this sugar called high fructose corn syrup, avoid those, because those get turned straight into fat. And they sort of bypass your normal metabolic channels. And so they are particularly bad for you. Avoid this fried, crispy, deep fried stuff, things with refined sugars. Increase things that have more fiber in them. Make sure you're getting adequate protein to make sure your muscles are healthy. So you can make these changes, and there are so many options. Today in 2024, everybody is internet connected. You go on YouTube, you'll find dozens of options of cooking very interesting meals, which are also healthy. And then if you embrace this as a family, as a way of culture and a way of life, without losing the kind of foods and the tastes that you grew up with, then I think the whole family can be healthier. And by doing these simple things, these are preventive things, right?
Right.
That reduces the need that one day we'll be having a talk about using high-tech stuff to do a liver transplant or do something very complex at high cost, and all of which comes with, there are many, many issues linked to all of those.
Yeah. During our conventions that we hold for Wellcon, we price the ticket at a very minimal amount, sir. And that's basically so that they are committed to attend the convention, which showcases all these aspects of how you could live a happy life, a healthier life. However, I have seen that at times when people reach the hospital, they will be folding their hands, requesting the doctor, please save our child, please save our parent or a spouse, or if I go on and that. But they're not willing to spend a little amount of money to take basic education and how they could look after. What are your thoughts on that, sir?
Well, I think it's sad when that happens, because every time somebody comes into the hospital with very advanced chronic liver disease, that means they have failed themselves, their family has failed them, and the medical system has failed them for a decade or 2 decades and allowed them to get to this point, because all of this is potentially preventable. And so think about your own culpability in the health of your family. For parents, I would say think about the health of your children. You think, oh, they're kids, nothing will happen, then let them eat because this is their time to eat, but it will catch up with them. So diabetes is a disease that we used to think about our grandparents. Then we saw it in our parents. Now we have a generation, we're seeing it in our children. So I'm not diabetic, but my child may be diabetic. And this is not an uncommon story that we are seeing. And we are at serious risk of losing an entire generation from diseases that we attributed to old age, but really happening to our younger generation. So this is extremely important. I cannot overemphasize the seriousness of this epidemic of diabetes, cardiovascular disease, liver disease, and it's all happening in the same individual. So it's like you're going to get punched from 6 different directions. Your kidneys, your diabetes, blood sugar, your heart, your liver, all of these will give out together. And so your best hope is to live a healthier lifestyle, get those regular annual health maintenance checks, manage the risk for all of these organs, talk to your doctor about the risk from all these organs, and develop a more holistic approach to living a healthier life with your family. It's not just a matter of your quantity of life. It's also the quality of life. And the healthier and the fitter you are, you will be able to enjoy all the wonderful things life has to offer to you.
Absolutely. So which is the most common liver disease you come across?
So the most common is something called steatotic liver disease or fatty liver disease. We don't like to use the word fatty anymore because, it is perceived as sort of insulting word because of popular perception, even though the liver is full of fat. So steatotic liver disease is really a condition where the liver accumulates fat. It is closely associated with our global pandemic of people with increasing obesity and in Asia and in India, many people, when you look at them, don't necessarily look obese, but they carry all their fat inside their abdomen. That is called visceral adiposity.
Okay.
And visceral adiposity is particularly dangerous and is linked to heart disease, diabetes, and also liver disease. And so this is the most common one.
So that means this is the first sign.
They, well, adiposity puts a risk factor
Okay.
for developing the liver disease. There are other liver diseases with alcohol plays in that role as well, but also there are pockets of places where there are still viral infections, virus infections of the liver, which are potentially highly treatable. Hepatitis C is essentially curable, and hepatitis B can be controlled in virtually everybody nowadays with the drugs that we have. And while there's more to be done in hepatitis B, we have very effective drug therapies for all of those. So really, getting tested once for viral infections of the liver, and if you have it, getting it treated. I know that in India, the government actually provides access to care and treatment for viral hepatitis.
Yes.
So take advantage of that. Minimize your alcohol consumption and live a more healthier lifestyle. Get your annual checkups. And I think that is really the message to keeping a healthy liver, and which will result in a healthy body and a healthy life.
We have noticed during our talk that Dr. Sanyal, Professor Sanyal, has been again and again emphasizing on lifestyle changes and the difference that it can make to our health overall. Sir, I have also been given to understand that you've started an institute in Virginia. Could you tell us a little bit about that, please?
Sure. So the Institute is really a culmination of several things. One, as you can see from my white beard, that I'm no longer a young man. So I had many conversations with the leadership of our university about legacy and continuing the work that I have been fortunate enough to have had a chance to start and get moving around the world. And so the Institute was originally created really as a legacy platform to train next generation and future generation of individuals who will be able to carry on the work we started. This was, of course, further galvanized by one of my very, very good close friend and colleague, Dr. Todd Stravitz, who gave us a very, very generous endowment to support many of the activities to really create the platform and take it to the next level. And so we're very, very blessed to have a benefactor like Stravitz, and thus the institute was named the Stravitz Sanyal Institute for liver disease. And our focus is really, it's not just liver disease, but looking at the health of the entire body through the lens of the liver. So it is the Stravitz Sanyal Institute for Liver Disease and Metabolic Health.
Wow, I think that's really wonderful, and I look forward to getting more information on that so that we could share it.
More to come. More to come. We are working feverishly to build infrastructure, recruit new additional scientists, and so we're really very exciting times for us.
Deep research work.
Yes,
as well.
But it takes time to get it right. You have to spend a lot of energy at the front end to build the infrastructure and do all of the stuff.
Sure, sir. It does take time, but I think building it up slowly and giving it shape would fulfill your
dreams and certainly, absolutely.
Yeah.
So in the words of Robert Frost, I still have miles to go before I sleep. And, there's still so much I have to do. But, getting this off the ground is right now a central part of my personal life.
It's the similar kind of feeling I'm having today, interviewing Professor Sanyal, because I've been meeting him over the past 7 to 8 years. He comes very often to India, especially teaching the doctors, sharing his knowledge. also doing a lot of public awareness programs. I have just a couple of
Sure.
quick questions. One, lately I've been seeing that people are popping pills off and on or taking tonics, liver tonics, and so on. And they feel that, okay, I've had a couple of drinks, and if I have pop up some pills inside, I should be fine. It doesn't affect. What would your thoughts be on that, sir?
There are two types of medicine. There's evidence-based medicine and there's non-evidence-based medicine. So around the world, we try to practice medicine that is supported by evidence. So we know that the recommendations we are making are backed up by actual science and not just beliefs. What we've learned over the last 100 years, particularly, is that when medicine or surgery is practiced based on the beliefs of an individual doctor or person, they're frequently wrong. And so that results in the potential for harm. And so from that has evolved this concept that medical practices need to be supported by evidence. In the modern medical world, there are very clear guidelines about the type of evidence that is needed to be able to say this works in this setting. And the bar is set quite high because the first principle of medicine is to do no harm. And so safety is number one. And then once you've established something is safe, then you have to establish that it actually works and benefits somebody. So these products have, by and large, little or no evidence by the standards by which we review all other medical interventions to support their use. They can occasionally also be toxic. So based on data in the US, where there's a national tracking system of people who come in with acute liver failure. This is a condition where the liver suddenly just melts away and you're literally, on the verge of death. And a substantial portion of those are actually due to natural products that people consume, thinking these are health products. Yeah. And because it's a natural product, it must be good for you. But remember, Dhatura is a natural product. Foxglove is a natural product, but they will kill you with certainty. And so just because something exists in nature doesn't mean it's good for you. So you have to be cognizant of that. You have to be careful about what you put in your mouth. Remember back to the concept of mindfulness. Absolutely. And then really having a conversation with your doctor about the risks and benefits of the kind of medicines you take. Taking things because of cultural beliefs is one thing, but the safety of some of those things you should really discuss with your doctor before you make it a habit.
Thank you so much, sir. So with that, we'll sign off for today. In case you guys have any questions regarding your liver health or overall wellness, please do connect with us, post your questions, and we will get back to you with scientific-based answers.
I look forward to that.
Thank you so much, Professor, and it's heartfelt gratitude.
Absolutely,
to have
it's
you
my
here.
pleasure. Thank you so much.
You.